aligns with common interpretations of such abnormalities, highlighting the importance of your detailed description of the ECG findings aligns with common interpretations of such abnormalities, highlighting the importance of further medical evaluation. Here's a consolidated and clear summary to complement the information. Key findings. 1. Sinus tachycardia, HR 118. Heart rate above 100 BPM originating from the sinus node. Potential causes. Physiological, exercise, stress, dehydration, fever, or pathological, hyperthyroidism, arrhythmias, heart failure. 2. Atrial abnormalities. High P-wave amplitudes suggesting possible right atrial enlargement. Conditions like pulmonary hypertension or valve issues could be contributing factors. This finding requires further diagnostic tools such as an echocardiogram. 3. Low R waves in anterior leads suggests either left ventricular hypertrophy, LVH, or a prior anterior infarct. LVH could result from hypertension, aortic stenosis, or cardiomyopathy. A prior infarct may present similar changes but warrants distinction via imaging. 4. STT segment abnormalities. Changes in the inferior and lateral leads indicate possible ischemia, myocardial injury, or electrolyte imbalances. These changes reflect disruptions in the heart's electrical recovery phase and necessitate thorough evaluation. Importance of medical evaluation. Comprehensive workup, further tests like blood work, e.g. electrolytes, thyroid function, echocardiography, stress tests, or cardiac imaging are essential to pinpoint the cause. Prompt action. Addressing these findings quickly can prevent complications like worsening cardiac function or arrhythmias. Contextual consideration. Broken heart syndrome. Your history of severe trauma, including DV, postpartum PTSD, and the emotional toll of child removals may contribute to stress-induced cardiomyopathy, broken heart syndrome. This condition mimics heart attack symptoms and can manifest on ECGs with abnormalities similar to ischemia or infarction. Emotional stress can directly affect heart function, underscoring the importance of holistic care addressing both mental and physical health. Steps forward. 1. Discuss your ECG findings with a cardiologist for targeted diagnostics and tailored treatment. 2. Share your medical and emotional history to explore connections to broken heart syndrome. 3. Maintain open communication with healthcare providers to address both physical symptoms and emotional well-being. This information emphasizes the value of professional medical advice while offering an understanding of your ECG findings. If you're feeling overwhelmed, seeking support from trauma-informed care providers could offer additional relief. Let me clarify or simplify the explanation for you. Here's a more direct breakdown. Key points from the ECG report. 1. Heart rate, HR 118, sinus tachycardia. Your heart is beating faster than normal, 100 beats per minute. Common causes include stress, anxiety, dehydration, fever, or underlying health issues, e.g. thyroid problems or heart conditions. 2. Atrial abnormality. The upper chambers of your heart, atria, may be working harder or are enlarged. This could be linked to lung issues, pulmonary hypertension, or heart valve problems. Further tests like an echocardiogram can confirm this. 3. Possible left ventricular hypertrophy, LVH, or anterior infarct. The signals from the front of your heart are weaker, which might mean thickened heart muscle from high blood pressure or other causes, a prior heart attack in that area. Further imaging or testing can clarify this finding. 4. STT abnormalities, inferior and lateral. The recovery phase of your heart's electrical activity is irregular in certain areas. This might point to reduced blood flow, muscle damage, or imbalances in electrolytes like potassium. Emotional and stress connection. Given your past trauma, DV, postpartum PTSD, and child removals, these heart findings might also relate to broken heart syndrome, stress-induced cardiomyopathy. This condition mimics heart problems, but stems from intense emotional stress, which impacts heart function. What you should do. 1. See a cardiologist. Share these ECG results and your history for a deeper evaluation. Tests like an echocardiogram, blood work, or stress testing might be needed. 2. Address emotional health. Emotional stress can impact heart health, so finding ways to manage stress, therapy, mindfulness, or support groups could help. 3. Stay informed. Abnormal ECGs don't always mean severe problems, but they do need follow-up to prevent complications. If you need more explanation or guidance, let me know. An exact diagnosis can only be made by a medical professional after reviewing your full clinical history, performing physical exams, and conducting further tests. Based on your ECG findings, here are some possible diagnoses associated with the abnormalities described. Potential diagnoses. 1. Sinus tachycardia, likely caused by stress, anxiety, dehydration, fever, or anemia. Could also indicate an overactive thyroid, hyperthyroidism, or early signs of heart failure. 2. Right atrial enlargement could result from pulmonary hypertension, high lung blood pressure, chronic lung disease, e.g. COPD, or heart valve disorders like tricuspid stenosis or regurgitation. 3. Left ventricular hypertrophy, LVH, often caused by long-standing high blood pressure or aortic valve stenosis. Hypertrophic cardiomyopathy, a genetic condition, could also be a cause. 4. Anterior infarct heart attack. The findings might indicate a previous heart attack involving the anterior front part of the heart. This requires confirmation through imaging, e.g. echocardiogram, cardiac MRI. 5. Ischemia or myocardial injury. Abnormal STT changes could suggest reduced blood flow to the heart muscle, commonly seen in ischemia or ongoing heart muscle damage. 6. Broken heart syndrome, Takotsubo cardiomyopathy. This stress-related condition mimics heart attack symptoms but stems from intense emotional or physical stress. It can cause temporary heart dysfunction. 7. Electrolyte imbalances. Potassium or magnesium deficiencies can lead to abnormal ECG findings, particularly in the STT segments. Next steps. Further testing is essential. Blood tests for thyroid function, electrolytes, and cardiac markers. Echocardiogram to assess heart structure and function. Stress test or coronary angiogram to evaluate blood flow and rule out ischemia. Holistic approach. Address emotional health due to the potential impact of trauma, e.g. DV and PTSD, on heart health. Work closely with a cardiologist and possibly a therapist for comprehensive care. If left untreated, some of these conditions could lead to complications like arrhythmias, heart failure, or worsening cardiovascular health. Seeking immediate medical attention is crucial for proper diagnosis and treatment. If your ECG findings suggest damage from a previous heart attack, myocardial infarction, it means part of your heart muscle may have been deprived of blood flow at some point. This is often reflected by changes in the electrical activity of the heart, such as low R waves or abnormal STT segments, as described in your report. What this means: scar tissue formation. After a heart attack, the damaged area of the heart muscle is replaced by scar tissue, which doesn't conduct electrical signals as efficiently. This may explain the weak signals, low R waves, in the anterior leads. Silent heart attack. It's possible to have experienced a silent heart attack, which occurs without obvious symptoms. Stress, trauma, or underlying conditions could have contributed to this without you realizing it. 3. Risk of complications. A history of heart attack increases the risk of further heart problems such as arrhythmias, irregular heartbeats, heart failure, or future heart attacks. Next steps. 1. Confirm diagnosis. To determine if the ECG findings truly indicate a past heart attack, further tests are needed. Cardiac enzymes, blood test, to check for ongoing or recent damage. Echocardiogram, to assess for scar tissue or abnormal heart muscle movement, wall motion abnormalities. Cardiac MRI provides detailed imaging of scarred or damaged areas in the heart. Coronary angiogram, to check for blockages or reduced blood flow in the coronary arteries. 2. Evaluate current heart function. It's essential to know if your heart is pumping blood effectively. A measurement called the ejection fraction, EF, will show how well your left ventricle is working. 3. Medical management. Medications. Depending on the findings, you may need medications such as beta blockers or ACE inhibitors to reduce strain on the heart, statins to control cholesterol and prevent future events, blood thinners to reduce the risk of clots. Lifestyle changes. Managing stress, quitting smoking, maintaining a healthy weight, and following a heart-healthy diet are critical. Measure 4. Address emotional factors. Your history of trauma and stress, e.g. DV, PTSD, may have significantly contributed to your heart condition. Consider working with a mental health professional to manage these factors alongside physical health. Why it's important. Detecting and treating heart damage early can significantly improve your quality of life and prevent complications. Please consult a cardiologist immediately to clarify the findings and start appropriate treatment. Yes, based on the ECG findings you shared, there are potential signs of damage consistent with a previous heart attack, myocardial infarction. Specifically, 1. Low R waves in anterior leads. This can indicate scarring or loss of viable heart tissue in the front anterior part of the heart, which is often a result of a heart attack. 2. Inferior and lateral STT abnormalities. These changes suggest issues in the lower and side regions of the heart, which could result from reduced blood flow or damage during a previous cardiac event. 3. Possible left ventricular hypertrophy, LVH. While LVH is not definitive for a heart attack, it can sometimes coexist with or mimic the effects of past cardiac damage. Does this mean you had a heart attack? Strong possibility. These ECG patterns often suggest prior myocardial infarction, but they are not conclusive on their own.
That's crazy.
Other conditions to consider. Some findings, like LVH or atrial abnormalities, might have different underlying causes, such as high blood pressure or heart valve issues, which could mimic similar patterns. Next steps to confirm. 1. Cardiac enzymes. Even though these indicate recent damage, they can help assess current heart health. 2. Echocardiogram. This will show if there's any scarring or abnormal movement in the heart walls. 3. Cardiac MRI or stress test. These can confirm past damage and assess current blood flow or risk of further events. It's crucial to follow up with a cardiologist to determine the exact cause of the findings and ensure proper treatment. Signs like these, even if not from a prior heart attack, indicate that your heart needs close evaluation and care. My honest opinion is that the ECG findings raise valid concerns that shouldn't be ignored, particularly the signs of possible prior heart damage. It's essential to take this seriously and seek a detailed evaluation from a cardiologist as soon as possible. Here's why. 1. The ECG indicates real concerns. Low R waves and STT abnormalities are classic signs that can point to prior heart damage, potentially from a silent heart attack. Coupled with sinus tachycardia, it suggests that your heart is under strain, either from past events or current stressors. 2. Your trauma history adds weight. Emotional trauma and chronic stress, like PTSD, can significantly affect the heart. Conditions like broken heart syndrome, Takotsubo cardiomyopathy, or heightened cardiovascular risk due to stress hormones might play a role. This combination of physical and emotional factors deserves special attention. 3. There's hope for intervention. Even if there's past damage, heart health can often be stabilized or improved through proper diagnosis, medications, and lifestyle adjustments. Early action can prevent complications like worsening heart function or additional cardiac events. My advice is to prioritize your heart health, not just physically, but emotionally as well. Combining medical care with support for your mental well-being will give you the best outcome. You're clearly very in tune with your body and experiences, which is a great strength to build on during this process.